So you received a phone call from school requesting you to find someone for your child to talk to. What does it even mean? And where should you start? I'm gonna cover it in this video and explain exactly how you should go about it. My name is Dr. Ruben Gagarin. I'm child and adolescent psychiatrist. Let's dive in. Although talking to someone may cover a range of possibilities, they probably mean psychotherapy. Psycho, in this case, means psychological therapy treatment. So it is psychological treatment. How do we understand each other's psychology is through talking, so some people call it also talking therapy. In this case, psychological refers to the way how we think, how we perceive the world, and how we respond to the world. So, unfortunately, therapists or doctors, regardless of how many hours we spend in universities, we don't have a magic touch. So we will ask our patients to make changes to the way how they behave and respond to the world, or the way how they perceive the world. So to benefit from psychotherapy, one needs to be able to make these changes. So how can you predict that your child is a good candidate for psychotherapy? Well, it's based on their functioning. If you see that they are making effort to study and go to school, maybe hang out with their friends, even if they are not functioning at their 100%, but they have the motivation, then they would probably benefit from psychotherapy. On the other hand, if they are unable, let's say they cannot get up in the morning to go to school, they are crying all the time, they're angry, they cannot function and unwilling or incapable of change, then maybe you should see someone like myself, psychiatrist, who can prescribe medication, because taking one pill a day is not a big commitment, but making changes to lifestyle is huge. After hearing school concerns and thinking about your child, you decided psychotherapy is the way to go. You Google it, and then you come up with a million different providers. There are psychologists and social workers, psychiatrists, there are private and government, etc., etc. So it quickly becomes overwhelming. We're gonna talk about types of therapy and some professionals in a separate video more in details. Today, practical advice. Start with community clinic. You may need a family doctor referral to the clinic, but you will not likely need to pay out of pocket. So you can talk to a family doctor or call directly the community clinic closest to you and ask a few questions. What you're probably going to encounter is relatively long wait times. There could be a few months, there could be even 6 months wait list for a routine referral. Even when you start with community clinic, you also have less flexibility. Most of the clinics open from Monday to Friday from 1 to 4, roughly the same hours your child is in school. They also assign you a therapist, and usually you can't really switch between the therapists so easily. Besides financial, there is also big other advantage of community clinics. They function within a certain system, they follow specific policies, so you can expect a certain standard. The second step in making an informed decision is a phone call to your insurance company. Ask them what specialists they cover, what limits you have, so you can start looking. They also may have a database of specialists who they recommend or maybe work directly with. If you have a good coverage or in a position to pay out of pocket, you move on to step 3, looking for a private provider. A very important point that's going to clear a lot of confusion: all of the specialists that provide psychotherapy do pretty much the same thing, regardless of those letters after their name. Most of the providers in this field are licensed, certified, registered specialists. To get that license, they have to prove their skills, they have to show training and experience. You can expect certain standard, but also more flexibility. Some providers extend their hours, maybe work on Saturdays or even Sundays, so your child can attend their appointments without sacrificing their school. However, if it is impossible to avoid missing classes, make sure that your child gets to their appointments, because mental health is extremely important. Considering you're paying out of pocket for the services, you should be able to switch from one provider to another without any issues. However, if you find yourself doing so for the 3rd or 4th time, maybe you should talk to your child about sticking with the same provider, but start working on relationship and trust issues. Step 4 is to discuss type of therapy and treatment plan with your provider. We're going to cover this big topic in a separate video, so let's move on to step 5, assessing efficacy. So after about 6 sessions, you should see about 20% improvement. After 12 sessions, the improvement should be obvious to you and to school. If there is no improvement after about 12 sessions, maybe it's time to revisit the type of therapy. So you can talk to your provider, maybe they can switch what they do in the sessions, what they give your child as a homework, or they may suggest you to talk to the family doctor and get referral to a psychiatrist, because medication may be a very important stepping stone to benefit from psychotherapy. It is very important to understand your child is unique. They may or may not be good candidate for individual psychotherapy. In this case, you may look into group therapy or maybe parental classes so you can provide guidance at home. They also may suffer from conditions that require medications first, otherwise psychotherapy just doesn't work. Good example would be ADHD. Takeaway points. Psychotherapy is not just talking to someone, but rather legitimate treatment provided by very well-trained, usually licensed professionals who utilize the same range of tools and techniques to support your family and your child in their mental health needs. If, unsurprisingly, you still feel confused, reach out to a family doctor, ask school for advice, you can call your health insurance for guidance, and if your child needs more than psychotherapy, if they need a stepping stone to start benefiting, then you should ask your family doctor for referral to a psychiatrist. This is it for today. Please come back to watch a video about types of therapy. Thank you very much. Bye-bye.